This entry in the Clinical Toxicology series is about nicotine, corresponding to Goldfrank's Chapter 82. The learning objective for this session is that you'll be able to describe the signs and symptoms of acute nicotine toxicity. The tobacco plant, Nicotiana tabacum, is the natural source of nicotine, which typically comprises 0.3 to 3% of the total weight of tobacco produced. To greatly simplify the tobacco production process, it's grown as a plant and then the leaves are harvested. The leaves are then dried and cured, both removing a great deal of the water content so that it can be burned to create smoke, and which also changes the color from green leaves to brown tobacco. And the tobacco is further prepared into various commercial products, much of which is smoked, but there are also tobacco products where the nicotine is absorbed through mucous membranes, such as with snuffs, powders, and chewing tobacco. The primary toxicity of nicotine, which is to say the greatest adverse health impact, relates to addiction, leading to chronic recurrent exposure, and then to chronic lung disease and cancers, most notably lung cancer from tobacco smoking. However, it's not just lung cancer, since there are at least a dozen different kinds of cancer with established links to tobacco use. But the focus of this course is on acute toxic effects, rather than complications of chronic exposures, so we're not going to be discussing the mechanisms and public health impact of tobacco here, even though those are interesting and important topics. Most people using tobacco will have some acute effects, but these are generally the user-desired effects, so these people won't be seeking medical attention and don't need any acute treatment. A significant exception here would be acute nicotine toxicity, as may occur from ingesting cigarettes and cigarette butts, as might occur with young children with their oral exploratory activity. This is a common enough scenario among calls to poison control centers that a standard approach has been developed. If a caller reports the ingestion of 1 or more whole cigarettes or 3 or more cigarette butts, the likelihood of some clinically significant symptoms is high enough that the poison control center will refer the caller to the hospital for a medical evaluation. The most likely thing to happen is that the exposee will develop nausea and vomiting. We can predict what kinds of signs and symptoms will occur from nicotine toxicity based on what we know about nicotine's effect on the autonomic nervous system and at the neuromuscular junction. And we can even talk about the expected toxidrome from nicotine, which will look a lot like a cholinergic toxidrome, but also with features of the sympathetic toxidrome. The graphic here shows the spinal cord on the left, and then its connections with autonomic ganglia and autonomic effector organs as we move towards the right. And at the bottom we see representation of motor nerves branching off of the spinal cord and connecting to skeletal muscle, which is part of the pathway of how our brains control voluntary movement. The capital letter N's show the synapses where there are nicotinic receptors, such that toxic exposure to nicotine would alter normal neurotransmission. Excess nicotinic tone increases the output from parasympathetic ganglia to parasympathetic effector organs. That can result in sludge syndrome, or the dumbbells mnemonic, as described in the toxidromes presentation for this course. Excess nicotinic tone at the neuromuscular junction can lead to muscle fasciculations, weakness, and flaccid paralysis, just as seen in the cholinergic toxidrome. But nicotine is also involved in the sympathetic branch of the autonomic nervous system and will overstimulate nerves in the sympathetic ganglia and at the adrenal medulla, resulting in some features of a sympathomimetic toxidrome too. When acute nicotine poisoning occurs, it's been described as occurring in 2 phases and having gastrointestinal, respiratory, cardiovascular, and neurologic effects. The earlier phase is most typified by vomiting, most likely mediated by parasympathetic overstimulation of the GI tract. Stimulatory CNS effects can also occur, but the most concerning acute issue is the possibility of seizures, mediated by overstimulation of nicotinic receptors in the central nervous system. The early cardiovascular effects of hypertension and tachycardia are sympathetically mediated, as would be pallor or pale skin from epinephrine and norepinephrine-mediated vasoconstriction. Later signs and symptoms are more depressive in severely affected patients with bradycardia, hypotension, and neuromuscular blockade leading to respiratory failure. Nicotine's severe toxic effects are not limited to humans or even to mammals, and nicotine-containing insecticides used to be available even for domestic use. You used to be able to go to a home supply store and purchase concentrated nicotine to apply around your garden to kill bugs. Here's an example of the product called Blackleaf 40 because it contained 40%, or 40 grams per 100 cc's, of nicotine. So this 5-ounce bottle contained 60 grams, and the estimated fatal dose of nicotine in humans is between 0.5 and 1.0 milligrams per kilogram, meaning that one bottle contained roughly 1,000 fatal human doses. This doesn't mean that people were dropping dead just by using the product as directed, but there's clearly the potential for severe effects from inadvertent exposure to or ingestion of even very small amounts. That's all for nicotine toxicity. I'll be seeing you around.